Should you or should you not list at different transplant centers? Stay tuned and let me tell you what I think about listing at different transplant centers. As a dialysis patient, one of the golden things that folks often talk about doing is to get you off dialysis and get you a transplant. A lot of dialysis patients do get listed for transplants. However, transplant is a different treatment. It's a gold standard treatment for folks with kidney failure. However, it is not a cure to kidney failure, which some clinicians actually do not talk about. Be aware of that. Kidney transplant is a golden treatment option for folks with kidney failure, however, not the cure. Now, if you're listed, a lot of times the waiting for a deceased donor kidney is going to take a long time, many years. On the average now is at least 3 years, more often 5 to 7 years for a lot of patients waiting for a deceased donor. Getting a living donor is often going to be the quickest route. If you have blood type of O, that it tends to be most difficult because you could only get donations from O type blood, and that sometimes can be up to 10 years, 7 to 10 years of wait time for a deceased donor kidney. And there are some states that are having a lot of folks on the wait list and not enough folks donating kidneys when they decease. States like California oftentimes can be 8 to 10 years wait for a lot of different blood types. Now, of course, many of us know that blood type is not the only consideration in terms of matching for a kidney. Is sort of the initial screening process of whether or not somebody matches. There are a lot of other matching factors in terms of getting a match for the kidney. And this is from American Kidney Foundation when they did a webinar over the last year or so on doing transplants. Sometimes it may be advantageous for folks to actually list at more than one transplant center. Here are some of the considerations when you list or want to list at a different transplant center. The transplant center, first, you want to make sure it's in a different UNIS region. UNIS is the national database that handles organ donations and organ transplants. And they look at where recipients are all over the country. There are different regions divided in the country for UNIS. Make sure your transplant center is not just within the same UNIS region to have a little bit more benefit and potential to have a kidney donated and transplant faster. Some other considerations with UNIS being a different region and transplant center being in a different region is that you need to be able to travel there. Often the transplant center will want you there if you get the call within 2 to 3 hours of that call. So are you able to do that quickly and efficiently? So most of the time that means a driving distance. Some people may have frequent flyer benefits or can access flights very quickly. Some folks maybe have friends or themselves are private pilots where they can fly to other states or other regions very quickly. Have a consideration of that. Now, in terms of travel, you also want to consider, do you have the resources and the ability to travel back to that transplant center or that transplant hospital after your transplant? Because most of the time within the first 1 to 3 months, you may have to go back there for follow-up labs and testing and to see your transplant team right after transplant. And sometimes those are 2 to 4 days a week that you need to do this. Most patients are not able to drive due to the medications and adjustments post-surgery within the first 1 or 2 months. You need to have somebody else travel with you and take you to and from these appointments. Do you have the resources to be able to do that? Some transplant patients plan and have an apartment or some place where they can stay for a month or 2 post-transplant with their family. That makes it a little bit easier to do that. My transplant center is an hour away, about 35 minutes with no traffic. However, if there is traffic, it could take me 2 hours to get there. So that's something I need to keep in mind and be considerate of as well. The other consideration you want to check when you're thinking about different transplant centers is, does all your insurance work? Medicare is federal, it does work in all states, and Medicare Part A covers all the in-hospital charges for the actual transplant surgery and while you're recovering in the hospital. However, once you're post-transplant and discharge from that hospital, those charges for follow-ups and whatnot of doctors and labs are in Medicare Part B. Medicare Part B still covers in all states, but you just want to make sure they take that at that hospital. Most hospitals that have federal funding do take Medicare Parts A and B, but you want to double check that when you talk to the other transplant center. Some folks are on private insurance, and if you're doing private insurance or workplace insurance, they may not cover you out of state. So you want to check on that and make sure it is applicable in the other transplant center, especially if it's in a different region out of state. If you're receiving Medicaid, state Medicaid for low income to be used as a supplement or insurance, that does not carry across state. Most of the time, you will not be able to have that coverage if you're going to a different state. Again, it's a question that you want to ask when you're doing the evaluation with the other transplant center. Those are the considerations, and definitely if you have access to other transplant centers and you have a support system, you have the resources to be able to get there within a reasonable time, and also there for follow-up, your insurance work, definitely consider listing in other places. I know folks that winter down in Florida, from the Chicago area, from the Northeast states, so their insurance and different facilities work the same between the two, and they've had that worked out, and sometimes they've been able to receive a transplant in a different state a little bit quicker than their home state. There are also folks from the Chicago area that go into Iowa or other states nearby in the Midwest where they get their kidneys, so that is always potential and possible. Some folks from Chicago also go up to Madison. Those are options that are available to you when you consider transplant and then just trying to reduce the wait time of your transplant. I choose to just stay in the Chicago area. I've been listed over 6 years, so I'm sort of higher up on the list right now to where going to a different state may not be a good option for me, as well as my insurance doesn't cover everything outside of Illinois. So those are my considerations for me. I hope this was beneficial for you. If you did like the video, give me a thumbs up. If it's the first time that you are joining me here at Kidney Journeys, please do hit the subscribe button so that you get information and new blogs when they become available and a notification. Thanks for joining me. My name is Kyle Chang at Kidney Journeys.